I keep seeing it everywhere. Headlines shouting that penises are getting smaller, articles claiming that everyday chemicals are sabotaging men's bodies. It's on social media, it's in the news, it's spreading like wildfire on TikTok. And honestly, it can feel overwhelming, even scary. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you ever have questions or concerns about your urological health, stay with me. We're here to help you understand your body with clarity and comfort without the fear-mongering. Today, I want to walk you through 6 habits that genuinely can affect penile health and size over time. And before you start worrying about chemicals in your drinking water, I need you to know that what you do every single day matters far more than what's out of your control. Number 4 on this list actually surprised even me when I looked at the research, so make sure you stick around for that one. Before we dive into the specifics, let's talk about what we actually mean when we say penile, shrinkage. Because there's a lot of confusion out there, and I want to clear that up right away. First of all, your penis isn't just what you see on the outside. It extends internally, curving down into your body. So when we talk about changes in size, we're usually talking about one of 3 things: actual tissue loss, reduced visibility due to other factors, or functional changes that affect how well your penis works. Some of these changes are reversible. Some of them, if caught early, can be prevented from getting worse. But some, unfortunately, can become permanent if you ignore them for too long. And that's exactly why I want to talk to you about this today, because knowledge is power. When you understand what's happening in your body and why, you can take steps to protect yourself. The reality is that your penis is not some isolated part of your body. It's deeply connected to your cardiovascular health, your metabolic health, your nervous system, even your hormonal balance. When those systems suffer, your penis suffers. It's basically a barometer of your overall health. And that's actually good news, because it means that taking care of your whole body automatically takes care of your penis too. I also want to address something right off the bat. A lot of men feel shame or anxiety about this topic. They worry that they're not measuring up, literally or figuratively. But here's the truth. The average penile length is around 5.2 inches, and that's completely normal. Anything within a wide range on either side of that is normal too. What I'm talking about today isn't about comparing yourself to anyone else. It's about protecting the health and function that you have right now. So let's get into it. These are the 6 habits you need to address if you want to maintain the health, size, and function of your penis for years to come. Number 1, stop smoking. I cannot stress this enough. If there's one thing on this entire list that you take seriously, let it be this one. Smoking is absolutely devastating to your penis, and I'm not exaggerating. Here's what happens. When you smoke, you're damaging your blood vessels. Cigarettes contain chemicals that injure the inner lining of those vessels, what we call the endothelium. And guys, good erections require good blood flow and healthy, flexible blood vessels. If those vessels are damaged, stiff, and narrowed, blood can't flow in the way it needs to. You'll notice weaker erections, shorter erections, and eventually difficulty getting them at all. But it doesn't stop there. Smoking also interferes with your body's ability to produce nitric oxide. Nitric oxide is essentially the spark that ignites an erection. Without it, the whole process falls apart. You might still feel desire, but your body can't respond the way it should. And then there's the long-term damage. Smoking causes what we call oxidative stress. Basically, it floods your body with harmful molecules that attack your tissues at the cellular level. In your penis, this means that healthy elastic tissue starts dying off and getting replaced by scar tissue. Scar tissue doesn't expand, it doesn't stretch, it's stiff and rigid. Over time, heavy smokers actually develop measurably less healthy smooth muscle in their penile tissue and more fibrous scarred tissue. This fibrosis makes it physically harder for the penis to fully expand during an erection, which means you're looking at a shorter, less functional penis. Now here's the good news. If you quit smoking, especially if you quit sooner rather than later, you can see real improvements in blood flow and erectile function. Your body has an incredible ability to heal if you give it the chance. Number 2, avoid weight gain, especially around your midsection. Technically, your penis doesn't physically shrink when you gain weight, but here's what does happen, and it's something a lot of men don't realize until it's already affecting them. When you gain weight, you also gain fat in the area right above your pubic bone. We call this the suprapubic fat pad, and as that fat pad gets thicker, it essentially buries the base of your penis. You lose visible length, even though the actual tissue is still there underneath. Think of it like this. Your penis extends back into your body. It's anchored to your pubic bone. When there's a thick layer of fat covering that area, it hides a portion of your shaft. Some men can lose up to an inch of visible length just because of weight gain. That's significant, especially when you consider how it affects confidence, intimacy, and even physical comfort. The solution here is straightforward. Maintaining a healthy weight, focusing on reducing abdominal fat, and staying active can make a real difference. And it's not just about appearance. Obesity is linked to so many health problems that indirectly affect your penis too, from poor circulation to hormonal imbalances. Number 3, use it or lose it. Yes, really. I know this phrase gets thrown around a lot, and I don't love it because it can make people feel pressured or ashamed if they're not sexually active. But there is some real science behind it, so let me explain what's actually happening. When you have an erection, you're bringing oxygen-rich blood into the penile tissue. That oxygenation is critical. It keeps your cells healthy, keeps your tissue elastic, and maintains the structural integrity of everything down there. Your smooth muscle cells, your blood vessels, all of it needs regular oxygen to stay functional. Now, even if you're not having sex or masturbating regularly, your body has a built-in protection mechanism. Most healthy men experience 3 to 5 erections during the night while they sleep. These are called nocturnal erections, and they serve a purpose. They're your body's way of making sure your penis gets that healthy, oxygenated blood flow, even when you're not consciously thinking about it. That's also why you often wake up with what people call morning wood. But here's where the problem comes in. When you develop health issues like high cholesterol, diabetes, high blood pressure, or heart disease, those nighttime erections start disappearing. Your blood vessels aren't healthy enough to support them anymore. And when that happens, your penile tissue stops getting the oxygen it needs. Over time, this leads to actual tissue atrophy. We've seen in studies that men who go 3 to 6 months without any erections at all can lose 1 to 2 centimeters of length. That's real measurable shrinkage. If you're noticing that you're no longer waking up with morning erections, or that you're not getting erections during the day either, that's a sign something's wrong. Please talk to your urologist and your primary care doctor. This isn't just about your penis, it's about your overall health. Number 4, don't let your kids become obese. This one genuinely surprised me when I came across the research, and I think it's going to surprise you too. There's evidence suggesting that childhood obesity can actually affect adult penile length. Now, this isn't something most people think about, but the science is starting to show a connection. There was an observational study done that looked at hundreds of adult men and compared their penile measurements to their childhood body mass index. And what they found was that boys who were obese before puberty were more likely to have shorter penile length as adults. Interestingly, obesity that developed during adulthood didn't have the same effect on actual size. It just affected visible length because of that fat pad we talked about earlier. Why does this happen? Well, the period before puberty is a critical window for genital development. Hormones are shifting, tissues are growing, everything is developing according to a very specific biological blueprint. When a child is obese during that time, it can disrupt those hormonal and growth processes, and those disruptions can have lasting effects. Now, I'm not saying this to scare parents, I'm saying it because early intervention matters. If your child is struggling with obesity, working with your pediatrician, a nutritionist, or other healthcare providers can make a real difference not just for their overall health, but potentially for their long-term physical development as well. Number 5, don't get diabetes, and if you do, control your blood sugar. I know that sounds easier said than done, especially if you have a family history of diabetes like I do. But this is incredibly important, and it applies to everyone, not just men. When you have poorly controlled diabetes, chronic high blood sugar wreaks havoc on your tissues. It causes inflammation, it damages nerves, it destroys blood vessels. And in the penis, all of that adds up to serious problems. High blood sugar causes healthy, smooth muscle tissue in the penis to die off and get replaced by dense, Fibrous scar tissue. Sound familiar? It's the same process we talked about with smoking. It also reduces your body's ability to produce nitric oxide, which again is essential for erections. And it damages the nerves that control blood flow and sensation to the penis. Over time, this leads to what we call tissue atrophy, which is just a medical term for tissues wasting away. The longer your diabetes goes uncontrolled, the more damage accumulates. But here's the hopeful part. If you manage your blood sugar well, you can protect yourself. Keep your glucose levels in a healthy range, monitor your hemoglobin A1C regularly, and if you start experiencing erectile dysfunction, take it seriously. Don't ignore it. Talk to your doctor and get help. Number 6, don't ignore changes in your penis. This last one is all about paying attention to your body and acting on what you notice. One condition I see far too often that men ignore until it's too late is Peyronie's disease. This is a condition where plaque or scar tissue forms inside the penis, often causing a curvature. And along with that curvature, there's often penile shortening. Now, we can't always prevent Peyronie's disease, but there are some things that seem to increase the risk. One of the big ones is penile trauma, especially small, repeated injuries that happen during vigorous sexual activity. I'm not saying you need to stop being adventurous in your sex life. Novelty and exploration are important, but there are smart ways to reduce your risk of injury. Use adequate lubrication, always. Avoid really aggressive or high-risk positions where your penis might bend or buckle unexpectedly. And if you're trying something new or experimental, make sure you're in control of the movement. Don't put yourself in a situation where your partner could accidentally fall or shift in a way that causes injury. We're also seeing more evidence that underlying health conditions like diabetes, obesity, and cardiovascular disease increase the risk of Peyronie's disease. The theory is that these conditions affect blood flow, promote chronic inflammation, and interfere with normal wound healing. All of that can contribute to abnormal scar tissue forming in the penis. If you start noticing pain during erections, a new curve or bend in your penis, or any other changes that feel off, please see a urologist. Early intervention can make a huge difference. We can help you preserve length, manage symptoms, and prevent the condition from getting worse. So now that we've talked about these 6 habits, let's talk about what you can actually do moving forward. Because understanding the problem is only half the battle. The other half is taking action. If you smoke, quit. I know it's hard. I know it's one of the most addictive substances out there. But the damage smoking does to your body, and specifically to your penis, is profound. There are resources available to help you quit. Nicotine replacement therapy, prescription medications, support groups, counseling. Use them. Your future self will thank you. If you're carrying extra weight, especially around your midsection, work on losing it. You don't have to become a bodybuilder. You don't have to run marathons. Just focus on eating a healthier diet, moving your body regularly, and making small, sustainable changes. Even losing a modest amount of weight can improve your visible penile length and, more importantly, your overall health. If you're not having regular erections, whether during the day or at night, get checked out. This could be a sign of an underlying health issue like diabetes, high blood pressure, or cardiovascular disease. Don't wait. Don't hope it goes away on its own. Make an appointment with your doctor and get evaluated. The sooner you address it, the better your outcomes will be. If you have kids and you're concerned about their weight, talk to their pediatrician. There are programs and resources specifically designed to help children develop healthy habits without shame or pressure. Early intervention can make a lifetime of difference. If you have diabetes, make controlling your blood sugar a priority. Work with your endocrinologist or primary care doctor to keep your glucose levels stable. Monitor your A1C. Take your medications as prescribed, and if you're experiencing sexual dysfunction, bring it up. It's not something to be embarrassed about. It's a medical issue, and we have treatments that can help. And if you notice any changes in your penis, whether it's pain, curvature, lumps, or anything else that feels off, see a urologist. Don't sit on it. Don't Google it and convince yourself it's fine. Get it checked out by a professional who can give you an accurate diagnosis and a treatment plan. I also want to emphasize something that runs through all of these recommendations. Your penis is not separate from the rest of your body. When you take care of your cardiovascular health, your metabolic health, your mental health, you're automatically taking care of your sexual health too. It's all connected. Eat a diet rich in whole foods, vegetables, lean proteins, and healthy fats. Exercise regularly, including both aerobic exercise for your heart and resistance training for your testosterone levels. Manage your stress, get enough sleep, limit alcohol, avoid recreational drugs. These aren't just generic health tips, they're specific evidence-based strategies for protecting your penis. And don't forget the emotional side of this. A lot of men carry shame, anxiety, or embarrassment about their penis size or sexual function. That stress itself can make things worse. It creates a vicious cycle where worry about performance makes it harder to perform, which then increases the worry. If you're struggling with that, please talk to someone. Whether it's your doctor, a therapist, or a trusted friend, opening up about these concerns can be incredibly relieving. You're not alone in this, and you don't have to suffer in silence. Alright, so those are the 6 habits you need to address if you want to protect your penis and maintain your sexual health for the long haul. I know some of this might feel overwhelming, especially if you're dealing with more than one of these issues. But here's what I want you to remember. Small changes add up. You don't have to fix everything overnight. Just pick one thing, one habit to change, one appointment to make, one conversation to have. Start there. Your body is incredibly resilient. It wants to heal. It wants to function well. Sometimes it just needs a little help from you. And the fact that you're watching this video, that you're seeking out information and taking your health seriously, that's already a huge step in the right direction. I also want to remind you that talking about these things matters. Too many men suffer in silence because they're embarrassed or ashamed to discuss sexual health. But this is your body, this is your life. You deserve to feel good, to function well, and to have access to accurate information and compassionate care. So if you found this video helpful, share it. Talk about it with your friends, your partner, your family. Let's normalize these conversations so that everyone can get the help they need without fear or stigma. And as always, remember to take care of yourself because you're worth it.